Is scoliosis surgery worth it? Many cases of scoliosis don't require surgery. The treatment results can never be guaranteed, but particularly with early detection and intervention, there are fewer limits that can be achieved with non-surgical treatment. Scoliosis surgery is a type of spinal fusion, and spinal fusion involves fusing vertebrae together, normally using something called pedicle screws and rods. Now, typically in a small local fusion, there's only one vertebra fused to a second vertebra, so there's only two bones that are fused. But when we look at scoliosis surgery, it normally involves fusing many vertebrae together. Anywhere from 5 to 7, 11, 12 different bones can be fused together, normally encompassing several areas of the spine. And we know when we fuse the spine, it fuses everything into one solid bone, and the metal rods are attached to hold it in place while the bone grafts take shape or heal. And many aspects of the vertebra are actually removed and eliminated. They remove the spinal discs, they cut out the posterior aspects of the bones. And the goal of this scoliosis surgery is not to even cure scoliosis. And it's not even to correct scoliosis, but it's to try to prevent it from progressing is the number one goal. As the curve's most tilted vertebrae are fused, they're hoping that the curve can't become larger because they're fused the unnatural vertebra, and then in the bone grafts taking place, the curve will stop worsening. Now, these days, in many cases, they're doing curve reduction with the spinal fusion, so therefore they can normally reduce the curve as well. But remember, the goal is really just to stop it from worsening. And the scoliosis surgery isn't curing scoliosis. In many cases, the person still has a curvature, but now they have a curvature with fusion within their spine. Now, is this type of procedure risky? Well, just a simple fact that they have to wait for the curvature to become a certain size before they can even consider spinal surgery should tell you that the risk associated with it. If there was no risk with spinal fusion or surgeries, scoliosis surgeries, they would do scoliosis surgeries in mild cases. But they normally have to wait for a scoliosis to become from mild to moderate to severe, and only in severe size cases they will consider a spinal fusion because the risk associated with spinal fusion. If there was no risk associated with it, they would do surgery in mild cases but because of all the negative risks associated with scoliosis surgery, they must wait to that size. The risk associated with the procedure itself can be infection, could be blood loss, could be adverse reaction to the hardware, could be nerve damage. There's also could potentially be long-term effects that could potentially be aware of. The problem is when we look at long-term effects, it's hard to determine because there is no significant studies that look long-term, 30, 40, 50 years post-spinal fusion, because most of the time these surgeries are done in very young children, 12, 13, 14 years of age, and they have all their whole life to have a fused spine with rods and screws associated with it. It's very difficult to know what's the effect of this spinal fusion long term. But one common effect to be associated is definitely decreased spinal flexibility and range of motion. The spine is less functional as a result of spinal fusion, not more functional. There's less motion associated, less mobility. A fused spine is weaker and can be more vulnerable to injury. Unfortunately, there can be increased pain at the site of fusion, and there could be further degeneration above and below the spinal fusion. And additionally, there could be hardware malfunction, which can lead to other things occurring, like rods can crack and break, the screws can become loose and dislodged from the vertebra. And the younger the patient is at the time of fusion, the longer the hardware has to perform optimally inside the body. And it's unrealistic to think that hardware can last an entire lifespan. We know hardware has to be replaced. So therefore, typically the only recourse is more surgeries if there's hardware malformation. And once a spine is fused, it is fused for life. There is no way unfusing it. We have hardware in the spine. Even if you remove the hardware, we know the spine itself is still fused. One other consideration is the idea of fusing a spine in a young patient that could potentially still be growing. So you have this curve that's progressing and it's becoming severe, and the person is growing. Once they fuse the spine, it stops any development or any growth in that area of the spine. So therefore, you can stunt growth of the spine. So a lot of times, doctors will have to wait to try to let the body and grow, but it's kind of like this balance of letting, how much do I let this person grow and potentially curve worsen before I do spinal fusion to try to stop the worsening. So it's kind of like a little bit of a balancing act, and making the right decision at the right time can sometimes be difficult because no one knows how much a curve will worsen, but we do know once you fuse, you're stunting growth. So it's a very difficult decision sometimes for doctors to make, and they're trying to figure out the best time. So sometimes a lot of patients are trying to avoid spinal fusion. And I think anybody would say, if you can control the size of curvature, keep the curve in the mild to moderate range, you better off preventing surgery. But it's when curves become so severe because they're not treated properly, conservatively, and they worsen 60, 70, 80, 90, 100 degrees. This is where patients have a concern about the impact the scoliosis can have. So we know non-scoliosis treatment is known as a conservative functional approach or a chiropractic-centered approach. And the reason why I like to call it functional approach, because the goal of conservative treatment is to maintain function of the spine while reducing the size of curvature. In a surgical approach, it's a non-functional approach. They're removing function of the spine while making the spine straighter. So one is functional, one is not. Conservative treatments typically are proactive and more integrative, meaning we're using many different types of treatments to try to impact the scoliosis on many different levels. And this is first and foremost, we must impact the scoliosis on a structural level, meaning we must reduce the size of curvature, because it's the size of curvature that's what's going to bring on a surgical intervention or surgical recommendation. So by making the curve smaller, we can reduce the need for scoliosis surgery and potentially reduce the need for even that recommendation of ever happening, because we keep the curve small. Normally, the way the treatment is combined is we normally use different types of conservative approaches like chiropractic care, physical therapy, scoliosis-specific exercises, corrective bracing, rehabilitation. And the key is to combine these in the correct manner for the patient to deal with the size of curvature and reduce the size by increasing strength, the surrounding muscles, and support and stability for the scoliosis. Non-scoliosis treatment, the goal is preserving as much as the spine function as possible while reducing the size of curve. So therefore, we're only dealing with less invasive treatment options. The risk associated with these treatments is very minimal compared to what we're dealing with when it comes to spinal fusion. And the best thing about it is that you retain spinal function throughout your entire life. And there's not need for further surgeries and further invasive interventions that potentially could have a negative effect. Now, we know there's still a place for scoliosis surgery. And the reality is we know that there are some patients that are still going to have scoliosis surgery. But many of cases don't need scoliosis surgery, especially if they're treated early and optimally conservatively. Here at the center, our goal is to treat scoliosis cases effectively, so therefore we can reduce the curve on a structural level to counteract the condition's progressive nature, to help patients avoid the risk associated with spinal fusion and spinal scoliosis surgery. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.